Well, it turns out that skin cancer is by far the most common cancer. It accounts for over 50% of new cancers alone in the United States. In fact, this year, well over 1 million new cases of skin cancer will be diagnosed in the United States. In fact, 1 in 5 Americans now will have a risk of developing skin cancer at some time during their life. Lancaster General Hospital has done some statistics that actually show that the incidence of skin cancer here in Lancaster County is higher than the national average and the state average. And also the mortality rate for melanoma is higher here in Lancaster County than the state and the national average. I think even though skin cancer can be a deadly disease, it can be cured if it's detected early. And gosh, what better way to help to accomplish this than to have Lancaster General promote these skin cancer screenings. Every May, since 1985, on a Saturday, several of us dermatologists in the community have donated our time with the help of Lancaster General Hospital to have these free skin cancer screenings. And over this period of time, we've actually picked up quite a few skin cancers, including some melanomas. So we actually are helping to advance the cure rate for skin cancer. These free skin cancer screenings really offer really a marvelous platform for us to be able to educate the general public on some of the significances involved with skin cancer and its prevention and its early detection. Anyone can develop skin cancer. No one's immune from skin cancer. It spans all age groups. It spans all ethnic groups. You know, there's just some people, though, that are at more risk to develop skin cancer. These are people that are fair-skinned, burn easily when they're out in the sun, people who have occupations that allow them to be out in the sun over a period of time. And this could be relevant to Lancaster County with our farmers, construction workers, people who have had severe sunburns during childhood and adolescence can be more prone to develop skin cancers later on. Also, people that have greater than average number of moles and the presence of what we call atypical moles are at higher risk to develop skin cancer, especially melanoma. And also people with a family history of skin cancer, whether it be melanoma or even other skin cancer, we pay attention to that. Well, the most common preventable cause of skin cancer turns out to be ultraviolet light. Both UVA and UVB form of ultraviolet light has been shown to be the cause in over 90% of skin cancers. People that have been immunosuppressed at some point also are at high risk. Our organ transplant patients are at very high risk to develop squamous cell cancers. Especially if they combine that with intense sun exposure during the course of their life. Well, I think the best advice would be slip, slap, and slop. Slip on a shirt, slap on a hat, and slop on some sunscreen. The cornerstone of really skin cancer prevention is liberal use of sunscreens. And our Academy of Dermatology recommends an SPF factor of 15 or greater, although I like to use 30 myself. And it should be a full spectrum. Remember, we're blocking both UVB and UVA radiation. Steps to include lowering your risk of skin cancer include, first of all, wearing protective clothing when out in the sun. Wear a sunscreen year-round with an SPF of 15 or higher, and reapply after swimming, sweating, or towel drying. Wear a hat that shades your face, neck, and ears, and protect your eyes and surrounding tender skin with sunglasses. And also plan your outdoor activities to avoid the midday sun, and please avoid tanning booths and sun lamps. They are not a safe alternative. Remember, this is any form of ultraviolet light, not just sunlight, but even artificial forms of ultraviolet light coming from tanning beds are harmful to your skin. That is not a safe alternative.